Hello, I'm Armida Carr, bilingual speech language pathologist, owner, and founder of New Horizon Therapy. Welcome back to Therapy Thursday, where I answer your questions or talk about a topic as it relates to speech or occupational therapy. Today, I will be talking about early intervention, early language development, when kids are 0 to 3 months, in the earlier months, in the first part of the year, because I do get children around the age of 2. We see a lot of toddlers, at the clinic around the age of 2, and sometimes parents are, I didn't know, and what are some things that I can look for? And one of the things I did want to talk about is gesturing. This is how children or babies learn to develop their language and their receptive language. So when we are, waving goodbye, saying hello, even though they can't say the words yet, they can start relating that to, oh, this means we're leaving, or this means we're saying hello to someone. So very important. Eye contact is another one. So eye contact is something that, when mom walks in the room, dad walks in the room, when they hear a voice, they should be looking towards us, and again, those earlier months, and responding to us. And if they start babbling and you start babbling back, sometimes it's that back and forth conversation that you're like, okay, they're listening. If you, and then to go with gestures, I know in speech we use them a lot. And, it's important for us when kids are coming to us that are nonverbal or not speaking, for us to start, more, or help, or goodbye, or hello. And again, we're trying to connect that language. And I'm just going to read a little bit about gestures and how they develop in the early months. And I can't remember them all, so I will go through my little paper. But when kids start using gestures at approximately 10 months, they should begin to point to objects, do like I want milk, and sometimes, take you to the fridge and point to this is what I want, or take you to the cupboard, or take you outside. And, and again, they're using those gestures because they yet don't have the words. And that's early on, 10 months. After that, between 9 and 13 months, again, kind of making those requests we just talked about. And then before a child can say, says 24 words, they have a gesture they've gotten used to, whether it's milk, or whether it's all done, or more. They start using that very consistently. And again, they're learning the language and they're learning how to use it. The other thing that we have around 18 months, they basically start combining gestures and words. So the more words they get, the less they start using those gestures. They will continue, but even as adults, we still use gestures when we're saying goodbye to a friend, or hello, or, when we're angry or mad. It doesn't necessarily have to include your hands. So I want to kind of tie that into, the language delays. A lot of kids today, are diagnosed with autism, and I've read a research paper, and it seems like the diagnosis just keeps growing and growing year after year. So, when we're looking at all these gestures, when we're looking at the eye contact, when we're looking at imitating, if your child is not doing that, don't automatically think, oh my gosh, this is autism. It could be a multitude of things. And the first place to go is your pediatrician, to talk to your pediatrician, to let them know. And there are some pediatricians that do not understand or really know language development and how it looks like and what is typical. And I've gotten referrals that some kids have been told if they don't have, they should have 2 words at 2 and 3 words at 3. And it doesn't sit well with me. But, know that we are here to help and answer questions, and we are not, in the field to diagnose anybody, but we can certainly help with language development. We can tell you when, or refer you to a place that can give you further diagnosis if we see other red flags. But our goal at New Horizon is to help both the parent and the child develop their language, and teaching them how, whether it's with gestures or other forms or other ways, we are here. So, ask me questions, give us a call, and I'd be more than happy to talk to you and, answer your questions, even if you decide not to continue with services or go through an eval. I'm always available, and again, my passion is to give education to parents, and adults across the board. So thank you so much for joining me today, and I look forward to seeing you next Thursday.